fewer women are dying after having cesarean sections. And that's both because they're making a decision to go to health facilities sooner, and once they get to the health facility, they're able to get access to the surgical care more quickly because they don't have to come up with funding on the spot. And there's also some thought that the quality of services being provided has also improved. So I think overall it's led to an increase in access for women to emergency obstetric care. One of the things that we did find, though, was that poor women were not observed to be accessing services as much as wealthier women. So there's still a disproportionate benefit in the sense that wealthier women were able to take advantage of this policy more frequently than poor women. So it's still a challenge to reach the poorest and most vulnerable women in the most rural areas with a policy like this one. What we found is that since the implementation of the policy, there have been really striking increases in the rate of cesarean sections. And that's been true both in urban areas and in rural areas, really widespread increases. So many women are still dying in childbirth, and it's happening around the world still to this day. And it's an entirely, or almost entirely, preventable way of dying. And I think it's really important to think about all the different ways that we can help address that problem. And if women basically can't afford to access care that they need, if they can't pay for antenatal care and they can't get themselves to a health center to deliver with a qualified birth attendant, and they can't pay for emergency obstetric care, and it's just sort of an egregious, horrible tragedy that this kind of a preventable death could still be happening.